When performing a flexor tendon repair, which of the following pulleys must be preserved? A. A2 and A4 pulley. B. A2 only. C. A2 and C2. D. A2 and A3. E. A3 only. And the answer is A. A2 and A4 pulleys. Now let's find out the reason for this answer. As an introduction, the complex hand flexor pulley system is essential in achieving an efficient flexor tendon function. This system includes A1 to A5 annular pulleys, C1 to C3 cruciate pulleys, and flexor sheath. It maintains the course of the flexor tendon adjacent to the phalanges and close to the center of rotation. This in turn allows the small joint in fingers to achieve a full flexion and avoid a bowstringing. This picture illustrates a pulley system, whereby the A2 and A4 pulleys are the most critical. Widening of the moment arm causes less motion of the fingertip and resulting in bowstringing. Cadaveric studies demonstrated that A2 and A4 are the crucial pulleys in maintaining a normal digit biomechanics. This study advocates the preservation of these pulleys or at least reconstruction if damaged. As a result, a few pulleys reconstructive techniques have been described. This is not only technically challenging, but also its benefit in improving a functional outcome is doubtful. Realistically, the preservation of A2 and A4 pulleys during repairing a flexor tendon laceration in Zone 1 and Zone 2 can be extremely challenging. This is either because releasing the pulley is needed for accessing the tendon or because the repair is catching on the pulley and preventing a smooth tendon gliding. Okay, thank you.